I want to bring in another expert as we continue to cover the coronavirus pandemic. Joining us now is Dr. Adam Brown. He's the chair of the COVID-19 National Task Force and an emergency room physician. Thanks so much. Good to see you again, Doctor. I'm not sure if you heard President Biden speaking just within the last hour or so. He talked about a COVID pill. What do you make of that?
Well, the pill that he's been talking about is one that was created by Pfizer and does seem to reduce the need for hospitalizations and does reduce severe illness if taken early. The problem right now is the availability of that pill. In many of the states around the country, they have instituted certain type of triage mechanisms of who should get that pill first, typically those being the most ill from a comorbidity standpoint, meaning they have other type of diseases that could put them at higher risk for hospitalizations if they are in the early phases of COVID. And so the step that the administration is taking in getting more pills is an important one because if in fact this holds true, meaning that it does reduce the number of hospitalizations, for people that are in early phases of COVID, that's a really good thing. But we just don't have that access there, despite the fact that the pill has been created, shows to be effective. We need more access to it. So this is a good first step, but not quite as far as we need to have it to really be efficacious against this really significant tsunami of Omicron.
Yeah, I'm really excited about the possibilities for that pill. But let's face it, doctor, there's so much mixed messaging. The Omicron variant accounted for over
Mm.
95% of COVID cases this week alone. But still, we have people who don't understand that it's spreading rapidly. At the beginning, we were told that if they didn't get it under control, there would be these new strains, which we're seeing, Delta, Omicron, and it would just keep mutating over and over and over again. So people are passing it along. We're not getting rid of it. Are we in a situation where we're going to see more and more strains if we don't get this under control and people don't stop spreading it?
Yes, sadly, I do think that we are going to see the coronavirus start to live within our communities on a long-term basis, very similar to the way that influenza is something that we deal with on an annualized basis. The most important piece here, though, is that the more times that we are vaccinated, the more times that people are infected by the disease, the more likely there is not only immunity within an individual, but also immunity across a community. And so that can prevent, in the long term, more severity of illness. But there are so many tools, Laverne, that we have at our disposal right now, whether it's a KN95 mask, or it's getting vaccinated and boosted, or taking these tests that were just mentioned to reduce the spread, that we really can do a lot to prevent those severe illnesses, especially with the most vulnerable, and reduce the chance for more variants of concern from being created. So we're in early innings in from a kind of global view of where we stand with the coronavirus in comparison to other type of viruses like the flu. We're just not quite there yet to kind of throw our hands up and say, well, everyone's going to get it. We have some tools at our disposal right now to prevent further infection and especially severe illness.
But people just don't want to do that. I mean, you have, entire states like Florida where they don't want the kids to wear masks, and that's coming from a government mandate. You're talking about wearing masks. We all know that. So when you have, once again, different people mandating different things, how are we going to get to the point where we get rid of it? Or as you said, it becomes like the flu where we're dealing with it year after year?
Well, sadly, I wish we were all singing from the same page of the hymnal, but we aren't. And for various reasons, there are some parts of the country that are choosing to buck some of the things that we know in science. Masking is one of those. We know with this variant that is so much more transmissible. We also know that this virus is airborne. We know other diseases that are airborne, and we know the things that we need to do as a society, as healthcare providers, to prevent as much spread as possible. There's really not a lot of debate within the scientific community about what we can do to limit airborne spread of the coronavirus. And so it saddens me, frankly, especially knowing many of my colleagues who are working in the emergency departments in Florida who are seeing, as I've spoke to them today and yesterday, significant number of cases and a huge rise in cases, not only in pediatrics, but also in adults with coronavirus due to the Omicron variant. So, Laverne, it's disheartening, quite frankly.
Doctor, before I let you go, is it okay for kids to still be in school? We know the holidays, people got together, cases are going up. What about our children? Is it safe for them to be in the classroom?
Yes, if we are taking the appropriate mitigation efforts. I'm glad you asked that question because I know that we want our kids to be in school, and there's a lot of evidence that we know now that keeping them out of school can have educational, psychological, and social harm. So keeping them in the classroom is very important. But we have to have teachers teach in the classroom. So if teachers are getting sick, those schools and those classes can shut down. And so wearing masks, those high quality masks like the KN95s, the N95 masks are important. Having your kids test before they go to school, doing those at home tests. Yes, they're screening tests, but if they're positive, they're definitely positive and they need to stay home.
Yeah, our
If they're
problem with
sick,
that is
they
getting
need to
those
stay
tests,
home.
doctor. The other problem we have is the
I
tests, getting
completely
those is
understand.
hard to get. So we've got so many, we have so many issues. But doctor, thank you. As always, you help us understand
Yes,
things so much better. We appreciate you joining us here today
happy to help.
on BNC. Take care. A new rule will benefit some people applying for jobs in New York City. After the break, the requirements some employers will have to follow as they hire people to take on more roles. Keep it right here. This is BNC.